Hello, this is an education video for Starmed Medical Education, Canada. Here, my name is Ibuka. I'll be talking about hearing loss. Not really that high yield, but it might be one of the surprises one might, have in exam. So, who literally have to prepare for everything. So when in the exam, for example, you have something in the door, maybe a patient presenting with hearing loss, and you want to read through that within the minutes allotted for that, and you want to go in there and introduce yourself to the patient and confirm the patient's identity, and then you want to go straight and ask your question. Maybe I understand you're here today because of difficulty with hearing, or because you find it difficult because you having hearing loss, and patient says yes. Then you may wanna empathize, at that point, like, oh, sorry about that, sorry to hear that, you know, and and they want to proceed to ask patient, so tell me more about it. And some patient might ask you, and what do you want to hear? You hear a lot of that when you ask maybe ask open-ended questions, as you advised, but then the patient feels you like, so the SPO might ask you, so what do you want to hear? So you can go straight to ask about the onset, your OCD QRST, OCD PQRST or something, and then you want to ask for onset. Although, of course, you know that mnemonic doesn't apply for everything. Yeah, I think it does perfectly for pain, but for you have to adjust it, or maybe you don't ask everything there. I noticed that a lot of us kind of waste a lot of time trying to ask all the questions there. Not all of them, and not every component of it is necessary. So, we know when to skip some. So, we want to ask for onset. When did you notice that? Okay, and then the patient tells you, and then at that point you might want to establish whether it involves both ears or just one ear. So you want to know which part of which ear or both of them, and then once that happens, you get that, you want to ask for how it was noticed. Is it sudden onset or is it gradual in onset? So when it's sudden in onset, it's concerning for maybe could be a sensory neural hearing loss or both of them actually. Maybe due to sudden loud sound or sudden loud noise, or maybe a bomb blast, of course, sudden, and or maybe a trauma, maybe a sudden slap, barrel trauma basically, and because it overwhelms the mechanism of the ear to handle such. So before the ear is adjusting to that through those muscles, stapedius, and the damage been done. So it's important to ask that. Then is it gradual onset? If it's gradual onset, you want to know how it's been progressing. Is it there? Is it getting worse or it's been the same? And then you want to find out. You want to characterize the hearing loss. So just to be clear, you want to ask patients, what are you able to hear? Just to characterize it, what do people tell you? Do they have to shout for you to hear? Or, do you have to turn on your TV set? or is it just a mild kind of hearing loss? And I also want to find out the frequency patient hears. Some hearing loss are specific with frequencies, like some will hear higher frequency better than lower frequencies, and so we want to find out that if the patient would understand that. So as much as possible, we want to use patients' layman's language, what patient will understand. So some people also hear better in a noisy environment than a calm environment. So we want to find out that. And of course, you also see some person with hearing loss speaking in a low voice. So these are things you want to find out, you want to see or identify. And then, of course, after characterizing the hearing loss, you want to explore symptoms of the ear, like ear pain. Do you have any ear pain? Do you have ear discharge? Any ringing in your ear? Dizziness and the fullness in your ear? And of course, you also want to ask for maybe your ear, nose, and throat symptoms, any runny nose, any previous flu recently. The for runny nose, of course, that could mean oxygen tube dysfunction, because upper respiratory function, upper respiratory conditions, pharyngitis, tonsillitis, or sinusitis, especially those affecting the area, the pharynx, where the oxygen tube drains might block it and then cause dysfunction and of course hearing loss. So we're gonna find out that then recent flu might point to labyrinthitis, vesiculatis, and then we might want to proceed to your nearby systems, neural symptoms or neural blocks. So can ask for headache, blurry vision, weakness in part of the body, loss of sensations in parts of body, and and any other neural block you might remember. But then remember, you don't have much time to review all the system to ask all the questions, so you flow with the conversation. Okay. And then you want to ask for fever, like for example, it all depends on, like, patient asks for, says there is discharge. When you ask the patient earlier, you might want to do your COCAB, then you might flow with fever. Otherwise, you might want to rule out malignancies, connective tissue diseases, vasculitides. You might ask for fever, weight loss, loss of appetite. Then you can go ask for medications. Some medications are known to be ototoxic. Of course, fusemide, gentamicin, SA. You might also want to bring them up when you ask for tinnitus, and you might bring one of like SA, fusemide. I think they can cause tinnitus, so you might bring them up there, and and then you might want to ask patients for occupation at this point. Like, you want to know if is it chronic exposure to loud noise. What do you do for living at this point? You want to ask that. Otherwise, you might want to leave it till you get to the occupational, to your social, occupational history. And then you can proceed to ask any medical condition for which you're seeing your GP for, or you'll be managed for, and then past hospitalizations, past surgeries, any medication. Are you currently on any medication? If you have, yes, for these drugs or toxic drugs, at this point you might want to ask, is there any other medication you're on? And then you can ask for allergies for them, or any known allergies, foods, drug, environment. And then you want to ask for family history, some hearing loss or something like otosclerosis can occur in family. And then, of course, you want to ask for, at this point, yeah, what do you do for a living? Let me know how it affects your daily activities and work. Yeah, so affecting function. So at this point, you're 5 in. You want to find out function. Very important, because let's say somebody that does a job that requires a lot of listening, like maybe taking orders, any level of hearing loss could impact the person more than an elderly man retired and just listening to the news or something at home. So it's important to find out how this has affected patient function, work, or daily activities, right? Apart from work, as work could be a risk factor, maybe exposure to chronic, loud work environment. It can also show how severe it is for the patient. Okay, and then being a GP, of course, because these exams are testing you at the level of a GP, so you are the patient closest friend, so you want to know, or maybe the patient closest buddy, you want to know about the patient, so that's the essence of having and knowing about the home. So you want to ask patient, tell me about maybe your home environment, who do you live with, your friends, your relatives, how relationship going, right? Social habits. You want to find out smoking, of course, alcohol, recreational drugs, because these might all have bearing to the symptoms patient presenting with. And then when I go ahead, ask for fears, and if you want to let me know any fear you want to share with me, any other concerns and expectations apart from these, then I want to ask patients for, open for questions. Do you have any questions for me? Then thank you for your time. So I think that's basically that. And yeah, there might be a lot of other questions that one might want to ask depending on how it goes. But these are basically that. In the exam, you don't have time for, to ask a lot of questions, So yeah, go for the main questions, and yeah, and hopefully it turns out well. So thank you very much for your time, for listening. That's it. Bye.